Good morning, all. Welcome to our 2023 Patient and Caregiver Symposium. And for the 75 people who are signed in online, welcome remotely. And for the 25 who are signed up to be here in person, welcome. And please don't hesitate, because this is really all about you all. It's really a program that we've done for 25 or more years, and basically has had the mission to impart cutting-edge progress that we all have had the pleasure to witness. The progress really depends upon a team that we have in part represented here, and our collaborative practice nurses like Julie, who's there, and our PAs, Melissa, Katie, Dom, who are all here on this table. Our residents, who actually are inspirations because they're the next generation who will take over this field, Andrew Knight, and the faculty. A couple of unsung heroes that we won't feature in our presentation this morning, and I guess I don't need to wear this up here, are our pathologists, our surgical oncologists, the people who do the work behind the scenes, who really make all of what we do possible, and we'll bring them next year maybe. The progress that we've had is nothing short of astounding. Having been in this field for close on 50 years, I can tell you that for 35 at least, we had nothing to change the outcome of melanoma survival, not in metastatic disease setting, not in the adjuvant setting, not in the prevention setting. We now have 24 agents that I'm not going to bore you with by reciting now, but the impact in metastatic disease is such that half of people who we would have predicted would have had life-threatening events from their melanoma within a year are now at 5 years still coasting, and dare we speak it, we really begin to think about the hope that these are patients who are cured of this disease, even in the metastatic setting. In the adjuvant arena, where Pittsburgh brought the first therapy to bear upon this disease, it was a very toxic therapy that took a year and 168 doses to deliver, cut the risk of relapse by a quarter. But 7 years ago, we saw the advent of new generation immunotherapies and new generation targeted therapies that cut the risk of relapse by more than half. And the paper that we presented just last fall in Edinburgh, just sent off to press this week, shows that this same treatment given a little earlier in disease, what we call stage 2B and C, cuts the risk by 58% of relapse. So this is really stellar progress. We've still got lots to do. The prevention of this disease from even initiating is something that will be the next chapter and a focus that several of us will devote our time to. But again, the focus of this morning for the next couple of hours is you, who are the patients and caregivers and interested folks who may have questions that if we don't address them, we want you to interrupt us, bring us back to task. And basically, my hope is that we will answer those questions and make them direct, transparent, simple answers, not convoluted, inscrutable answers. And then I think the thanks this morning for our supporters, Bristol Myers Squibb, Karen Peterson, who's been a pillar of support for many years, Nick Gentile from Natera, who's introduced a whole new angle on monitoring this disease that we really didn't have before, Mitch Hillman from Novartis, who've given us the first targeted treatment that works in adjuvant treatment of melanoma, and Pfizer, who've been there for a long time, Tara and Mia. We thank you for support, because it's really a team effort, and you're part of the team as well. So this is an AIM and Pittsburgh Cancer Institute, now Hillman UPMC, Hillman Melanoma Program effort. But the partnership with AIM has been a very rewarding one that began back in 2004. And I'm going to ask Anne to come up from AIM to give the overview and mechanics of this, since they've helped with setting that up. And the focus for all of the support that we bring in with this and our walk against melanoma on the 13th at the Boathouse in North Park, which is a lovely venue that we will hope to see all of you at as well, is tissue banking, because without the tissue, we don't understand what goes on with these new therapies. The tissue banking is critical to that. The annotation, information about the tissues, where Mary Horak will talk about the registry and database, is crucial to understanding and to moving the field forward again. So thanks for coming, and Anne, please take it away.
Thank you. Good morning. I'm Anne Garst-Taylor, and I'm with AIM at Melanoma. It's my great pleasure to represent our foundation here today. For those of you who don't know, AIM was founded 19 years ago by Val Gill when she lost her precious daughter at the young age of 26 to melanoma. And since that time, it's been AIM's mission to end this disease in our lifetime, and also to support people who are living with melanoma. And I'll have the opportunity at the end of today's symposium to talk to you a little bit about those supports. But between now and then, I have two jobs that I need to do. The first very important job is to thank Hillman Cancer Center and Dr. Kirkwood and all of our panelists today for the presentations that we will hear. I know that they will be informative and full of hope. We're all looking forward to that. And I want to be sure and mention Lisa Huntley, who is a mastermind organizer and organized today's symposium. So thank you so much to her. But the second thing that I want to do is I know that everyone is going to have questions for today's panelists, and I need to explain how we're going to handle that. If you're here with us today, we have given you a packet of information, and in there is a pen and a pad. And if you'll write those questions down, I'll get them to Dr. Kirkwood so that he can answer them for you. But if you're joining us virtually, you're coming to us either through Zoom or Facebook or YouTube. If you are joining us through Zoom, then what you will need to do is there is a chat feature. You're welcome to tell us where you're from. We love for you to talk with one another, but you need to put your questions into the Q&A tab that's there in Zoom. And if you're joining us through Facebook or through YouTube, then just put your question into the chat feature there, and we'll grab that and get that to Dr. Kirkwood also. And with that, I will turn it back over. Thank you so much.